Well, fully vaccinated Americans can stop wearing masks outdoors and now in most indoor settings as well. The new guidance still calls for masks, though, in crowded indoor settings, buses, planes, hospitals, prisons, homeless shelters. But this recent news, still major development here, could help clear the way for reopening workplaces, schools, and other venues. Earlier today, I spoke with Dr. Emily Sickbert-Bennett with the UNC School of Medicine about what Americans still have to keep in mind when it comes to COVID. The case rate, the lowest in September, the deaths at their lowest point since last April, the test positivity rate, the lowest since the beginning of the pandemic, and now 154 million of us at least have one dose of the shot. So that is definitely progress, and maybe another burst to come because of the approval this week for 12 to 15-year-olds as well. Not to be too cliche here, but is this the biggest sign yet? There is some light at the end of the tunnel, and we are going to get out of this mainly, not entirely, sometime later this year.
Yeah, absolutely. This is really showing us, I think, how much progress we made and how much of a bright future we really have ahead. The more people that can be vaccinated, those numbers will continue to drive even lower, and we'll just see fewer and fewer transmissions in our communities.
And do you think this decision today was driven by the numbers we just talked about, or is there a little bit of a PR move here to increase the number of vaccinations, kind of signaling to the unvaccinated, hey, once you get the shot, you can pretty much go back to normal?
I think this decision was likely based on several factors. Just as you said, certainly as epidemiologists, we monitor very closely what the case levels are in the communities and what transmission is looking like. And if we weren't headed in the right direction, then it certainly wouldn't be the time to loosen up some of our control strategies. It definitely will serve, hopefully, an important role in really incentivizing people who maybe haven't been ready before now to get the vaccine, to help them to see that this is really a strategy that if they're willing to do, that can help loosen some of the other infection prevention strategies.
People who take this news today and head back out to restaurants, bars, parks, games, concerts, whatever it may be. Certainly not all of us are vaccinated. Not all of us will get vaccinated. Are we at all risking another surge as people kind of, especially now the weather's getting better, rush back out to all their favorite places? Are we risking any kind of setback because, again, we're not going to get to 100% vaccination?
That is certainly a concern that I think many epidemiologists have, is just whether we have achieved enough of a level of vaccination across all of our communities to really keep transmission from going down. Because something is safe doesn't mean it's 100% safe. So every decision you make can help to be a safer decision. So thinking really carefully about activities that you did before the pandemic, choosing which ones to add back in an incremental fashion is definitely a safer and more moderate approach, instead of restarting everything at the highest levels as we were before the pandemic.
Mm. Well, certainly another milestone this week, a week full of milestones, quite frankly, between the 12 to 15-year-olds and now this mask announcement today. So clearly a lot of progress and a lot to celebrate, but not quite done yet either. Thank you so much for giving us some time tonight and for your insight. We appreciate it.
Thank you.